Hi, I'd like to welcome everybody to this afternoon's webinar discussing the dynamic machine testing, checking the relationship between cow and milking machine with our speaker, Tom Greenham. Tom is the director of the Advanced Milking Limited Consultancy Company and looks at all aspects of health and health and the milking machine optimization. Providing specialist advice for dairy farmers in the UK, Ireland and around the world. So we're very lucky, especially considering Tom's background in veterinary medicine with 10 years of dairy practice prior to setting up the Advanced Milking with Dan Humphreys, with a significant affect his interest in machine impacts, mastitis, milk quality and milking efficiency. Today's webinar will be looking we'll be discussing different aspects of this with Tom, and then from there we'll be looking at some of the Farm Connect services. We'll ask if you'll please use the question and answer facility at the bottom of the screen. If you've got any questions, you can add your name in there if you want to be stated, and otherwise just please leave your questions towards the end. We'd be very, very grateful. This meeting will be recorded and it will be put up onto the Farm Connect website if you'd like to look back at it afterwards, or if you've got any friends or neighbours that would also like to view the webinar later on. And if we'll take a look at some of the Farm Connect services found on the website. So Farming Connect at present are offering a number of digital surgeries, providing one-to-one advice with a number of different expert consultants. These will be tailored to your business needs. We aim to arrange them as quickly as possible. They can be on a range of different subject matters, from woodland, marketing diversification, infrastructure, soil analysis. But if you are interested at all, please contact your local development officer, and they will kind of discuss with you and find the best consultant available. There's also a host of different training on offers at the moment. We're in the middle of a training window with Farming Connect currently. It'll be open until the 26th of June. The training courses are up to 80% subsidised. If you are interested in any training currently, some of the training providers are providing digital access, but if you contact your local training provider and your development officer, they'll be able to provide you with any information that's required. Then from there, we've got a number of upcoming webinars, and thank you for attending this afternoon's one. There will also be trace elements later on tonight, with another on Tuesday and Thursday of next week. They're on a range of different subjects. I've heard Joe Angel of Wern Vets a number of different times on trace elements, and I have to say he's an incredibly interesting speaker, so I really do recommend attending tonight's one. We've also, if you have got anything of interest or any different questions for your local development officers, are definitely your first point of contact, and are an incredibly useful source of knowledge for you. You'll find each of our contact details on the website, or if you contact the service centre if you can't find it another way. The other thing I really do suggest for you is looking at the sustainable farming co-design. This is our one opportunity to really have our say in looking at new payment systems. So therefore, I really do suggest having a look at the Mentor Business website, filling it in and having your say. It is our opportunity to take, so I really do advise you to take that. So thank you very much. I ask that you'll use the question and answer feature at the bottom of your page and leave everything till the end if you can. And fantastic, thank you very much. I hope we enjoy Tom.
Thank you very much, Natalie. Thanks both for the introduction and for the invitation to come and speak today. If you just bear with me, I will bring up the presentation that we're going to use in our discussions. Okay, so as Natalie's just introduced, we'll be talking today about the relationship between the cow and the milking machine, and also how we as farmers, vets and advisors can measure and monitor that relationship to make sure that things are as good as possible for both cow health, cow comfort and milk quality. So we'll start by looking at how the milking machine affects the cow. I guess the first question to explore is, how big a deal is the milking machine when we're talking about udder health? And like most things, it varies from farm to farm. But as a general rule, somewhere around 10 to 15% of new infections can be tracked back to milking machine causes. And to look at how this actually occurs, it's worth us just reminding ourselves a little bit about how mastitis happens in the first place. So for us to have a mastitis infection, first of all, we need to have living mastitis bacteria on the end of the teat. Those bacteria then need to cross the teat canal. And once they're inside the teat, they actually need for conditions to be suitable for them to survive and thrive within the teat so that they can then proliferate and grow inside the udder. And the first three of those stages can be significantly affected by the milking machine. So it's quite obvious that the milking machine can have a role in transferring bugs to the teat end. That can happen with liners, can happen with other infrastructure such as brushes or dip cups, and even on the hands of the milking team. But more technically, there are a couple of other areas that are affected by the machine. So we said that bacteria need to cross the teat canal, and that's much easier for them if we've got rough teat ends or teat end hyperkeratosis. And that's certainly something which is affected by our milking machine performance. And similarly, the milking machine will have a big effect on the amount of teat swelling that we see in the milking herd. And this teat swelling or teat edema plays a big role inside the teat in allowing bacteria to have an easier ride when they're colonizing that teat before moving on to infect the udder. So first, let's have a look at hyperkeratosis. I'm sure that most of you have seen the odd rough teat end here or there through your herds. Hopefully you haven't seen too many, and hopefully they haven't been as bad as this. But hyperkeratosis is basically a thickening of the skin at the end of the teat. And when that teat skin gets thicker, it starts to crack, and those cracks are the ideal environment for dirt and therefore bacteria to hide in. As well as the increased contamination that hyperkeratosis aids, hyperkeratosis also makes it easier for bugs to cross the teat canal itself. So why do we get this hyperkeratosis? It's basically a protective mechanism. So you can think of hyperkeratosis in the same way as the thickening of the skin when we get calluses on our hands. So say we were doing a load of digging or some sort of manual graft, constantly traumatizing our skin causes it over time to build up a thickness or a callus. And that's exactly what we're seeing at the teat end. As the liner, the milking liner, collapses and folds around the teat, we get an application of pressure. And the more that liner curves, the higher the pressure, so that the greatest pressure is focused up on the teat end. Unfortunately, exactly where the hole in the teat is. And this compression, this compressive load, is affected by both the vacuum that we're milking our cows with and also the properties of the liner. So as a general rule, the higher the vacuum, the higher the pressure on the teat end, because higher vacuums pull the walls of the liner closed with a little bit more force. And then as far as the liner properties go, thicker walls give a greater pressure, and the tougher the liner, so rubber compared to, say, silicone, will give us a greater pressure on the teat end, and also how that liner is mounted inside the shell. So if that liner is stretched really tightly, it's going to give us a greater risk of hyperkeratosis because of more pressure on the teat end. So this liner compression, the higher it gets, the higher the risk of hyperkeratosis. But we don't actually want it to go too low either, because at low liner compression levels, we see another side effect, which we've already discussed today, which is our teat edema. Now, teat edema is basically a result of the blood supply in and out of the teat being disrupted. And what we can see when we're visually examining these cows is a change in colour, so darker red or purple teat skin, and a change in shape as we get swelling, deforming the normal shape of our teats. And people often think that that's a direct relation to the amount of vacuum that we've got, but it's not really a problem with the size of vacuum. The main cause of teat edema comes from where the vacuum is. So if we have a really good fitting liner, the only part of the teat which is exposed to high vacuum is the very end of the teat. And of course, at that point, the teat is getting massaged by the pulsating liner, and so any edema that does build up quickly gets dispersed. The problems come when we start to see a less snug fit between the liner and the teat. So if, as in this example here, we have a very wide bore liner, we can see that the vacuum can actually get all the way around the teat. And so the whole teat is exposed to vacuum and at risk of swelling. Now, in this case, the lower half of the liner will massage some of that edema away, but the upper part of the teat in the mouthpiece doesn't get that massage. And so this situation would give us that classic ringing that you see, where the base of the teat just below the udder is a little bit swollen and fatter than the lower portion of the teat. So wide gauge liners or wide bore liners can increase the amount of teat edema that we see. But that's not the only problem. Another cause of teat edema is when the depth of the mouthpiece is too big. And we see this a lot in stubby-teated Holsteins and particularly heifers where they have quite short teats. And because the teat doesn't engage with the barrel of the liner, again, we have this situation where the vacuum can surround the whole teat. And in this case, we don't get any massage because the liner walls don't contact the teat. And so the whole teat is able to swell up. And not only are these changes happening on the outside of the teat where we can see them, this swelling is also causing changes inside the teat. And so the swollen tissue puts pressure on our blood vessels, and that's what disturbs the blood flow out of the teat, giving us that pink or purple colour. And further to the visible changes, we also have some changes in the function of the teat. So this disruption in blood flow leads to the tip of the teat becoming much stiffer. And that has two outcomes. Firstly, that stiffness around the teat canal reduces milk flow rates because the teat end isn't able to open as completely during milking. And so we start to see slower milkings when we see a lot of teat edema. But worse than that, we see more mastitis. And the reason for that is that those stiff teat ends don't close as quickly or as completely after milking is finished. And so rather than the teat end being open for 20 or 30 minutes after that cow leaves the parlour, the teat end may be open for 3 or 4 or 5 hours after that cow has gone back out to pasture or to the pens. And so that open teat end is a big risk for mastitis bugs entering the inside of the teat. So they're the main factors that cause our teat problems, our hyperkeratosis and our teat edema. But of course, there are a few other factors that contribute as well. We need to check that our pulsation settings are correct so that the teat is getting a long enough rest with each milking cycle that the liner allows. And of course, any negative impact that the milking machine has on the teats is going to be increased if we keep that unit on the cow for a longer period of time. So we also need to assess the automatic cluster removal settings to make sure that we're not over milking these cows. Or for herds that don't have parlours with ACRs, we can introduce measures such as a maximum unit on time to make sure that we're not leaving the unit on the cow for an excessively long period of time. But it's not just the machine which affects the cow. Characteristics of the cows can also influence how the machine performs. So for example, with liners, we talked about the pressure that they put on the end of the teat. That pressure is actually bigger for teats that have pointed ends. So teats that we find on Jersey cows, for instance, they're quite a pointy, carroty shape. And that shape leads to the force being magnified, and so a greater risk of hyperkeratosis. Different cows also have different milk flow rates, based partly on their yield and partly on how open their teat ends are, which is a genetic factor in most cases. And the speed that those cows drop their milk into the cluster can have a big effect on the vacuum that we find inside that cluster. So this graph shows the vacuum in kPa that we're seeing inside the cluster. And for the first half of milking, when the cow is dumping milk at a very high flow rate, we can see that the vacuum is almost 10 kPa lower than the vacuum in the same spot during a low flow period at the end of milking. And so if we were to extrapolate that across to a high flow herd and a low flow herd, those herds would make the milking machine work in a very different way, despite the fact that it was the same machine with the same settings. And that holds true as well for how well our cows are letting down their milk. So milk letdown, the basic theory behind that is that milk is stored in two different places inside the udder. About 20% of the milk is in this header tank area, the gland cistern, and that milk's free for us to take as soon as we put the unit on. But the 80% of milk which is in the little glands, the little bubbles of the udder, requires us to stimulate the teat and then wait 70 or 80 seconds for that milk to be squeezed out into the cistern where we can access it. And so if we just attach the cup to the cow straight away, in about 30 seconds, we will have taken all of the milk that's readily available in the cistern, that header tank, but then we'll have a gap of 30 or 40 or 50 seconds where we have no milk flow because we haven't yet had time for the cow to let her milk down. And so that as well is going to affect the vacuum that the teats are exposed to. So how can we actually see whether or not these problems are present on our farms? Well, we can do some milking machine testing to measure these different parameters and identify whether or not these problems are there. So traditionally, we've done static testing where we've measured the vacuum in various regions of the milking machine and decided whether or not that's likely to be giving us a good milking. But in actual fact, those measurements don't really give us a very accurate representation of what's happening at cow level. So to work out whether or not we're milking these cows efficiently, quickly, gently, we need to actually look at what's happening at the business end. So in a dynamic milking machine test, we measure the vacuum below the teat, inside the liner. We measure the vacuum inside the liner at the base of the teat, the mouthpiece of the liner. And we look at what the liner is doing in terms of its interactions with the wall of the teat. And we've got a few little bits of kit that can give us this information. So on the left here, we've got a vacuum gauge, which is very small, very light, and we can keep it on the milking cluster throughout milking to measure what's happening at the base of the teat and the tip of the teat during that milking. And so every cow that we milk through that unit, we're going to build up a picture of just how good those milkings are. On the right-hand side here, you can see one of my colleagues measuring the amount of force which the liner is applying to the teat. And so that again can inform us on our machine settings and our liner choices so that we can get exactly the right system for our particular bunch of cows. So the sort of results that we see are things like this, a vacuum graph which shows us how towards the end of milking, vacuum rises inside the mouthpiece. And so this gives me an indication that we've got about 2 minutes of over milking. And so not only is that 2 minutes that we could save per row of cows, which over a few rows of cows obviously means that we get a bit of breakfast a little bit earlier, but also it's 2 minutes of extra wear and tear on those teats. So an increased risk for hyperkeratosis and potentially an increased risk of teat edema as well. We've already looked at how milk flow rates will alter vacuum. And when we see vacuum inside the liner changing as we do in this graph, it lets us know that actually the machine is struggling to move milk away from the cows as fast as we need it to. We also talked about liner fit and how we want well-fitting liners to avoid teat edema. If we don't have that, we start to see the vacuum in the top of the liner rising. So here our blue, green and black vacuum levels show us that mouthpiece vacuum is much too high. And because of that, we start to see a lot of swelling of those teats. And this kind of graph lets me know that this cow has had poor milk letdown. To start with, we have about 30 seconds of good milk flow. This big spike in vacuum shows that milk flow has stopped, and that lasts for another 45 or 50 seconds. And then the vacuum drops in this period when we hit peak flow again. That would be a biphasic or a bimodal milking. And again, that's a risk for hyperkeratosis and potentially teat edema. So our main goal when we're looking at milking machine performance is to give ourselves a herd of cows with healthy teats, because healthy teats are easier to clean because they have smooth teat ends. They have better barriers against bugs invading the inside of the teat because we have a tighter closure of the teat end. And they have better immune defenses inside of the teat because the blood supply isn't disrupted. The milking machine conditions that give us these healthy teats are actually a big win all the way across the board, because as well as giving us healthier teats, they also give us a more comfortable milking for the cow. They usually give us a quicker milking, which is obviously better for the cows and better for the milking teams. And because of those two things, we're likely to see big cost benefits for the dairy business as well. Conversely, if we have inappropriate settings for our milking machine, whether that's inappropriate vacuum, incorrect pulsation timings, poor ACR settings, or poor liner choices, all of those things will contribute to us having teat health problems. So greater levels of hyperkeratosis and greater levels of teat edema. And both of those things are a risk for mastitis. So we need to adjust our machine settings and choose our liners carefully to make sure that the machine is milking that particular herd of cows with that size of teat, shape of teat, and milk flow rate as well as it possibly can. Now, we can only really make those decisions and tweak the machine to optimize it if we have information of what the current situation is. And the best way of getting that information is by testing the machine, not just at its static service test, but during milking. So we can see that it isn't just hitting the targets for factory performance, but it's working as well as it needs to for our herd of cows. So that is a little bit of a whistle-stop tour through the way the milking machine can affect the cow, the way different cows will influence the milking machine, and what we can do to measure those different scenarios so that we can manage them. Obviously, it's a pretty big topic, so we've barely scraped the surface today, but hopefully there's been a few points of interest, and I'd be delighted to take any questions that anybody's got based on the presentation specifically or milking machine performance in general.
Thank you very much, Tom. It was an incredibly interesting presentation. As you say, I dread to think how little you've scratched the surface on that one. I've got a few questions for you. One of the questions is, my herd has a range of sizes and shapes within it, of different teats and different breeds. How can I choose a liner to best fit all of the cows?
That's a great question, particularly because it's one of the biggest headaches that we face in liner choice. So if we have a herd where 90% of the cows are identical in terms of teat size and shape, then we have a fairly easy job. But when we've got some cows with big teats, some cows with little teats, it's a bit more of a challenge. Now, the quick answer to that question is that we need to do the most good for the most number of animals. So we can have a look at what proportion of the herd fall into big teats, small teats, or whatever other permutations we've got, and make our choices based on the most amount of good that we're able to do. The more technical answer is that we tend to find that, to a certain extent, big teats will milk through smaller liners with less harm than smaller teats milk through baggy liners. And so I'll often size liners towards the smaller end of the herd. Obviously, there's a bit of an exception with that, in that if we're stuffing massive teats into very small liners, those cows just won't milk out. So you have to look at the range of teat sizes and shapes that you're dealing with. But this is actually something that next Thursday's Farming Connect webinar will look at in more detail. So next week's webinar, we're looking at all of the different things that we need to consider when we are choosing liners for our herd. So we'll perhaps go into a little bit more detail next week on that question.
Oh, fantastic, thank you. The other one is, what potential reasons could there be for poor milk letdown and biphasic milking that you mentioned?
It's a good question, because there's actually a few different reasons which can give us the end result of poor milk letdown. Most people are aware that the letdown of milk is a reflex, and to provoke that reflex to get the cow to let her milk down, we need to touch the skin of the teat. And so that's where our teat preparation comes in. But it doesn't happen straight away. So as well as touching the teat, whether that's by fore-milking or whether that's by dry wiping the teat, or whether that's by dipping and wiping, it doesn't matter too much what method we use, but we need to touch the teat. But we then need to wait a certain amount of time to allow that milk letdown process to occur. So there'll be some milk which is ready for us to take off the cow straight away. But for us to get that 80% of milk out of the main part of the udder, we'll need to wait 60 to 90 seconds. And that 60 to 90 seconds isn't just me hedging my bets. It actually varies a little bit depending on the cow. So if the cow's coming into the parlour with a very full bag, she'll only need about 60 seconds for that milk letdown process to occur. But if she's coming in with less milk on her, maybe we're milking 3 times a day, so she only has 8 hours of milk building up rather than 12 hours of milk building up. With less milk in the bag, we actually need to leave a longer amount of time between stimulating the teat and milk letdown happening. So there, I might be advising people to wait for 90 seconds between touching the teat and attaching the milking unit. But there's a third thing which can interfere with that milk letdown process. And this is the thing which is often forgotten. So we know that we need to touch the teat and we know that we need to wait a certain amount of time. But that milk letdown process, even if we're doing everything else right, can still be disrupted if the cows are stressed. And we probably don't have time to go into the technicalities of that now. But suffice to say, if the cows are stressed or uncomfortable coming into the parlour, whether that's because we've herded them in with a snappy dog, or whether that's because a relief milker's been a little bit less patient than usual, or whether it's because of something like stray voltage, if the cows are stressed, that milk letdown process won't happen. So those are the three things we need to consider. Are the cows calm? Are we touching the teats? And are we waiting the right amount of time after touching the teats before we attach the unit?
Oh, thank you. We've also got how often should we be testing the vacuum of our machines and also changing the liners, with also how are the liners affecting the back to scan results?
There's two good questions in one there. To look at the first one of vacuum, the obvious answer is that you need to do whatever your milk contract dictates. So whether that's a 12-monthly or a 6-monthly service, we obviously need to be hitting those contract rules. I'd actually recommend, even if you're only required to do a 12-monthly service, that you check vacuum and pulsation every 6 months, because it's not very time consuming, it's usually not very expensive, but it does have a big effect on the udder health if those vacuum and pulsation settings have drifted. So checking them every 6 months obviously is kind of increasing the chance that we pick up on any problems early. We also need to remember, of course, that the vacuum that we are looking at our static test isn't the vacuum that we're talking about at cow level. So that's just a point to bear in mind. The second part of that question, I think, was about changing liner frequency. And it's an interesting question because it'll vary a little bit depending on the what your liners are made of and a couple of other factors. So we tend to see that rubber liners last a little bit less long than silicone liners. If you're using things like backflush systems, then your liners will probably last a little bit less than they normally would without that extra chemical flowing through them. For most rubber liners, a general rule of thumb would be 2,500 milkings. And that's still a nice, easy rule of thumb to use when we're talking about the liner change frequency. The thing to remember with that is that if you've worked out that you need to change your liners every 2.5 months, you need to change the dump bucket liners or the dump cluster liners then as well, even though they won't have had the same amount of milkings. And that's because it's not just the process of milking which ages a liner, it's general exposure to the atmosphere. So just once they're out the packet, those liners start to age. So even though your dump system liners won't have as much milking time as your normal liners, still change them when you change the rest of the liners. And when you do change the liners, it's worth actually slitting a few open and having a look inside them. And that gives you a bit of an idea as to whether you've got a lot of wear and tear, whether you've got cracking, whether you've got buildup of residue in there. And if you do see problems, it might be that you need to tweak those changing frequencies a little bit there.
Oh, fantastic. As a bit of a side question to that, what could some of the reasons be for the incorrect vacuum within the teat?
So it may well be, when we're talking about incorrect vacuum, we're talking about vacuum below the teat separately to vacuum at the top of the teat. So vacuum in the mouthpiece of the liner isn't related to our system vacuum at all. It's purely related to how good a fit we've got between the liner and the teat. So if we've got too high a vacuum in the mouthpiece of the liner, up at the top of the teat where it joins the udder, that isn't that our vacuum settings are wrong, it's that our liner dimensions aren't appropriate for that teat. So that's vacuum in the mouthpiece. If we look at the vacuum in the lower part of the liner, that's completely separate, and that is dictated by our system vacuum. So system vacuum, we always lose a little bit of vacuum between the milk pump and the liner, partly because of things like leaks, partly because of the air bleed in the cluster, and partly because we lose some vacuum when we're moving milk through the system instead of air through the system. So during milking, the system vacuum, if we measure it up at the receiver, might be 50 kPa, but the vacuum down in the lower part of the liner might be 45 kPa, for instance. So we lose a little bit of vacuum between the pump and the cow. But as a general rule, if we were to put system vacuum up by 1 kPa, we would also see a rise of approximately 1 kPa at cow level. So system vacuum will move that cow level vacuum up and down a little bit. The other thing that will alter that vacuum inside the liner is the flow rate of the cow. So if the cow's dropping milk very quickly, that might reduce the vacuum by 3 or 5 or 7 kPa, depending on how good the machine is at moving that milk away. So high flow rate cows can drop vacuum inside the liner. And that's an even bigger effect if the machine has got some resistance to moving milk away from the cow. So if we've got a high line parlour and we're having to lift that milk away from the cow, we're likely to see lower vacuums inside the liner than if it was a low line parlour and we were dropping the milk away from the cow. Or if we've got long milk tube that goes around a few different corners or goes through some milk meters, we'll see a little bit more resistance to flow, and that as well will drop the vacuum inside the liner. So those are the things that will contribute to the vacuum at the teat end of the cow, the vacuum inside the liner. What the system vacuum is, what our milk flow rates are, and how much resistance to flow there is when we're moving that milk away from the cow.
Fantastic. The last question we've got is regards to different types of liners. The person's asking about Waikato square liners and how different liners are affecting the vacuum and how they're having positive influences.
It's a good question, because we talked about how the vacuum up at the top of the teat in the liner mouthpiece is affected by the fit of the liner to the teat. And that particularly comes into play. That becomes significant when we're talking about shaped liners. So shaped liners, whether that's things like the Waikato quadratics. Sorry, say again?
Could I pause you? Can you repeat the start of the question? We had a few technical issues then.
Oh yeah, fire away. So
if you could start again from the start of your answer. Sorry, we had a few technical issues.
Sure. So with our shaped liners, such as the square liners like the Waikato quadratics or the Fullwood squares, or triangular liners like the Milkrite Impulse range, or clover-shaped liners, such as we have with Delaval and so on. All of those different liner shapes act in a slightly different way to our round liners, and that'll affect two things. Firstly, those shaped liners have a slightly lower risk of teat end hyperkeratosis because they don't focus the pressure on the tip of the teat in the same way that a round liner does. So we'll often use shaped liners if we've got a herd that's got high levels of hyperkeratosis and we're trying to reduce the pressure on those teat ends. The flip side of shaped liners is we can see higher mouthpiece vacuums with those shaped liners. Because they aren't round, they may not be as good a fit with the teat inside of them. And so there might be more gaps for vacuum to get up into the mouthpiece and increase the vacuum at the top of the teat. And as we've discussed earlier in the webinar, high vacuums up at the top of the teat are a big risk for swelling and teat edema there. So it can be a little bit of a trade-off. With our square, triangular or clover-shaped liners, we may see improvements in teat end health, but we may also see bigger risks of high mouthpiece chamber vacuum. With our round liners, we may, in certain circumstances, see a greater risk for hyperkeratosis, but we may also see a lower risk for teat edema. So it's a little bit of a trade-off. And this is why there isn't a one-size-fits-all solution for each herd. We need to weigh up the priorities for that individual herd or that individual bunch of cows. And the other thing with liners that we need to remember, and we'll discuss this a little bit more in next week's webinar, is that we can make the same liner work in different ways by altering the vacuum and the pulsation. So we can make one individual liner milk out very quickly and aggressively, or by changing the machine settings, we can make the same liner milk out more gently, albeit a little bit slower. So we also need to consider how the liner performs in the context of our vacuum and pulsation settings.